So in this video presentation, we'll just continue with the heart. You should be following along in your PowerPoint packet, and we are on the middle of page 163. You should also be filling in the words as we go. So now we're going to start to talk about structure and function. This is a strange picture or image that you're seeing on the slide. So what you're seeing is just one half of the heart, and this particular picture just the left half. So before I go into details, let's look and see what we have. We have our left atrium, our bicuspid valve, which is the valve on the left side. We have our chordae tendineae, whose job is to keep those valve flaps opened and closed. And we have the left ventricle. We also see the aortic semilunar valve, which in this story is closed, in the aorta. So we're going to focus primarily on the left side of the heart. This also occurs on the right side, but we're, for simplicity's sake, just going to look at one half of the heart. So what I want you to understand, the purpose of this is to see how the valves are opening and closing in conjunction with one another. So what happens when the bicuspid valve is open? So blood is going to flow from the left atrium to the left ventricle. Next, the aortic semilunar valve is currently, if you look at the picture, closed. The blood is now sitting in that left ventricle. The tension on the chordae tendineae, if you look in the picture, is low because the bicuspid valve is open. So now let's take those same concepts. The blood is now just gone into that left ventricle, and see what happens as we're pushing that blood as that ventricle is squeezing up through the aorta. So what happens when the bicuspid valve is closed? So looking at the picture, now the left ventricle is squeezing. The tensions on the chordae tendineae, can you fill it out from the picture? Good, is high. The aortic semilunar valve is now open because we got to get that blood up to the aorta and out to the body. And blood is going to flow from the left ventricle into the aorta. Okay, so we're going to start to kind of switch gears a little bit and see some more heart structures and then kind of put all these pieces together. So blood supply to the heart itself. So we're talking about the heart. So we've talked about how the heart contracts and it's going to push blood through the different body parts, to the lungs, but now let's see the actual heart itself. It's going to be supplying blood to what are called the coronary arteries, which supply blood to the heart wall. It is important that you don't have any coronary arteries that are clogged or have blockages, otherwise it can lead to a heart attack. We will discuss heart issues or diseases further in this presentation. The right coronary artery, this is pretty basic, supplies blood to the right ventricle. And again, we're more focused on the ventricles because they do more of the work than the atria. The left coronary artery supplies blood to the left ventricle. You should recall that arteries carry blood away from the heart, supplying blood to different structures. And veins are carrying blood towards the heart from a previous structure. Let's go back to that picture that I skipped, sorry. Let's go back to that middle picture. All right, so in this middle picture, you're going to see a lot of terms. We've actually seen this picture before. So let's kind of just do a quick review. So we see the word sarcolemma. Sarcolemma is pointing to the cell membrane on the outside of our muscle fiber, which is a muscle cell of our heart. You should recall that the sarcolemma is the cell membrane of a muscle cell, in this case, your cardiac muscle cell. We see sarcomere. It's the contractile unit which is going to contain actin and myosin. We see the word myofibril. We see the word sarcoplasmic reticulum. Recall that the sarcoplasmic reticulum stores calcium, and we just mentioned calcium is required for muscle contractions. You also see the word T-tubule. All of these, again, were discussed in Chapter 7. Action potentials. So we cannot leave the heart chapter without discussing how the heart actually beats. So think of this. Someone is having a cardiac episode, whether they are having a heart attack, etc. Often they are given a defibrillator, which is full of electricity, to basically get their sinus rhythm, their heart rhythm back to normal. So in previous chapters, we have looked at depolarization and repolarization. We also said that we had something called the resting membrane potential. Your heart does not rest, however, so we're still going to look at different phases at a cardiac muscle contraction, but they are slightly different than a skeletal muscle. The concepts are the same, it just has a few variations. So an action potential from chapter 8 was basically an electrical impulse that caused a change in charges. So a change in membrane channels permeability, so things like sodium channels, which you can see in this picture, potassium channels, and now we're going to also focus in on calcium, are responsible for producing action potentials, and this is called the pacemaker potential. In other words, the opening and closing of these channels and how quickly that happens determines how quickly your heart beats. It is not uncommon for someone to have a pacemaker put in to basically keep these electrical impulses coming at a regular pace. What you should note on this slide before we continue is that we're seeing a phospholipid bilayer, that's our sarcolemma. The outside of the cell is initially negatively charged. The inside of the cell is initially positively charged, and we're going to see how sodium, potassium, and calcium are involved in these action potentials. So we have 3 phases of an action potential. These are very important concepts to understand. So instead of having resting, depolarization, and repolarization, which was a skeletal muscle, now we have depolarization, plateau, and repolarization. We will look at a graph on the next few slides to also explain these concepts. So what is occurring in depolarization? Depolarization is exactly the same as it was in a skeletal muscle. Sodium channels open, sodium is rushing into the cell. The inside of the cell becomes more positive. Potassium channels remain closed. Calcium is the new ion and the most important ion when discussing the heart. Calcium ions or channels are now open. Now we get to the plateau phase. So if you're drawing a graph, a plateau is going to be kind of a leveling off at the top. Depolarization would show the graph going up, and then the plateau would be kind of leveling off. So in plateau phase, sodium channels close, and some potassium channels start to open. Again, the ion we are most concerned with in the heart is calcium. During the plateau phase, calcium channels remain open. In the repolarization phase, the graph is going to go down. Sodium channels are still closed, and then potassium channels are open. Also, calcium channels will also close. So you need to know what each of these ion channels is doing during each of these phases. Let's look at this more in depth on the next slide. So before we look at the words, let's look at the graphs. These 2 graphs are purposely not labeled. So graph A shows the graph goes up, depolarization, and immediately back down, repolarization. The time it takes for this muscle contraction to occur, again, what we're talking about is your heart beating. It's a muscle, it's contracting, is about 2 milliseconds, very, very quickly. Graph B is showing depolarization. The graph goes up. We're again measuring these in millivolts. Then we see a plateau phase where we level off, and a repolarization where the graph goes down. This can take up to 200 milliseconds or 500 milliseconds. This is a much slower contraction. So which graph do you think is cardiac muscle and which graph is representing skeletal muscle? I hope that you said that graph A is skeletal because there's no plateau, and graph B is cardiac because there is a plateau phase, and it's going to contract more slowly. The plateau phase prolongs the action potential by keeping those calcium channels open. The reason we need your heart to beat much slower than your skeletal muscles is all of that blood needs to get through all of the chambers and then out to the body or out to the lungs. In skeletal muscle, action potentials take 2 milliseconds. That is extremely fast. In cardiac muscle, it is much slower, almost 100 times slower, 200 to 500 milliseconds. So let's continue this idea of electrical impulses going throughout your heart. So this conduction system of the heart is basically saying if we had electrical wires and we were placing the wires, the electricity, throughout your heart, where would they be placed? As you can see in this figure, the majority of those electrical wires, steps 4 and 5, are going to be in the ventricles. There is some electrical impulse or action potentials that are created in the right atrium and in the upper portion of the heart, but since the ventricles are the major pumping chambers, they need the majority of the contraction and the action potentials. So the conduction of this system of the heart means the contraction of the atria and the ventricles. And again, the ventricles are going to contract more than the atria. So we're going to begin with some new terms. So the sinoatrial node is a structure, SA node, located in the right atrium. This is where the action potential begins. This is often where a pacemaker is put in a person's body, in the heart. This is where we're going to see it happening in the right atrium. So the reason why the electrical impulse begins in the right atrium is because this is also where blood flow began. In the right atrium, in the sinoatrial node, located as number or labeled as number 1 in this diagram, it has an extra large number of calcium channels. That is because we need to prolong that plateau phase to get that blood from the right atrium to the rest of the heart structures. This structure, the sinoatrial node, is also known as the pacemaker. So now we're going to look at steps or numbers 2 through 5. So first we're going to look at the name of the structures and then we'll put all these pieces together. So now we go from the SA node to step number 2, which is the AV node, still located in that right atrium. It's called the AV node because it's between the atria and the ventricles. Step 3 is the AV bundle. We're now at the base of the right atria. And again, these are numbered in order. You should know them in order. Step 4, the AV bundles now split into right and left bundle branches. The right side goes to the right ventricle and the left side goes to the left ventricle. Again, the ventricles are the major contracting parts of the heart. Step 5 are what are called Purkinje fibers. These are the structures that are going to go deep into the ventricles to allow those ventricles to contract. So there's a YouTube video that goes along with this, also located on Blackboard and a part of your animation worksheet, to get a visual of how all these pieces fit together. All right, ECG or EKG. So we're not going to go into details, and you do not need to know what a P, Q, R, S, T waves are and what they do, but all I want you to know is these are a test. So someone says you need to get an EKG. What that test is doing is recording the electrical events of your heart. This could diagnose cardiac abnormalities. So this could say whether your ventricles or potentially even your atria are not contracting fully. So an EKG is very minor. If you're having this done, you basically sit still. They put some electrodes in different places of your body, and within a minute they can record what's happening electronically with your heart. Cardiac cycle. So a cycle is something that goes in a circle. So before we look at the words, let's just look at the pictures. So we have two major events happening, something called dystole and systole. In dystole, your heart is contracting for a brief period of time. The chambers are filling with blood. And in systole, your heart, specifically your ventricles, are contracting and you're pushing blood to the next region. So the heart is two side-by-side pumps, the right side and the left side. The right atrium ventricle, the left atrium ventricle. The atria are what we call the primers. They get things ready. They're going to hold the blood till it's time to move to the next chamber. The ventricles are the power pumps. Their job is to contract or squeeze tightly to push the blood into the next area, either out to the body or out to the lungs. The cycle is the repetitive pumping action, the opening and closing of these chambers and valves. This includes contraction and brief relaxation. So let's start to put all of this together. So we have some more words and figuring out, and then we're going to talk about blood pressure. So the cardiac muscle contractions produce large pressure changes in the heart. These pressure changes are responsible for blood movement. So here's the way to think of this. If you were to take a straw and poke a hole in it, and then try to suck fluids up to the straw, it would not happen because there would be no pressure difference because there's a hole in this case in the straw or in your heart. So these pressure differences are responsible for the blood flow. These pressure differences occur when the ventricles squeeze or contract and cause pressure changes. So blood moves from areas of high to low pressure. Just like we've talked before about diffusion, molecules can move from high to low. Pressure is also going to move from high to low. This will also be discussed in greater detail in the lungs and the respiratory chapter. So it is important that all the valves are not open or closed at the same time. So we need to make sure the valves are opening and closing in unison. In other words, the two AV valves are open, but the two semilunar valves would be closed. If all of the valve chambers were open at the same time, you would have no pressure difference and the blood would not flow correctly. So as those ventricles squeeze or contract, it's going to open certain valves, AV valves or semilunar valves, and close other valves. So let's look at some words. So our first, these are all definitions, it's atrial systole, is contraction of the atria. Then we have ventricular systole, that is contraction of the ventricles. Atrial dystole is relaxation of the atria, or filling of those chambers. And ventricular dystole is relaxation of the ventricles. All of these chambers and valves opening and closing cause blood pressure. Again, there are additional animations that go along with this PowerPoint presentation that I highly recommend that you view. They are also located on. So what is blood pressure? It's a force of blood exerts on the blood vessel walls. Blood pressure also tells us whether or not you have something going on with you. In other words, it's a diagnostic tool. Systolic pressure is the contraction of the ventricles, and diastolic pressure is relaxation of the ventricles. You can see in this view or the slide, you would place the blood pressure cuff on the patient's arm right around their elbow. That is going to be called the brachial artery. You would then pump the cuff up to a certain pound of mercury, in other words, pressure, slowly release the valve on the blood pressure cuff. As you do that, you should get two numbers, the systolic and the diastolic number. The systolic number is the top number, the diastolic number is the lower number. And again, that's a measure of diagnostic test, telling you whether or not the patient has something. So normal blood pressure, depending on the textbook or lab manual, is either 120/80 or 110/70. They are both equally correct. The 120 number is the systolic number, the 80 or 70 is the diastolic number. If these numbers were too high or too low, it would potentially tell you what's going on with the patient. Hypertension, hyper means above, is high blood pressure. If the doctor cannot get your blood pressure regulated by a diet and exercise, which is sometimes the case, then they will often put you on a blood pressure medication. Heart sounds. So now you would have out a stethoscope and be listening for certain sounds. A stethoscope is used to hear lung and heart sounds. The first sound you hear with the stethoscope is what we call the lub. And the second sound is the dub. That lub dub, that's what we're talking about. And what you're really hearing in the stethoscope is the opening and closing of the valves. Heart murmurs are due to faulty valves. We will talk more heart conditions on the next few slides. Regulation of heart function. Your heart rate will tell us at rest specifically, again, if you're feeling okay. So the heart rate is the number of beats per minute. It should be on average about 72 beats per minute. If you've exercised, that number would go up, and then when you relax, that number should go back down. Recall our discussion on homeostasis, set point, and negative feedback. Cardiac output is the volume of blood pumped by a ventricle in 1 minute. This is about 5 liters of blood pumped per minute. You should recall that the average person has 5 liters of blood. So in 1 minute, pretty much all of your blood has been pumped throughout your body. Heart procedures. Angioplasty is the procedure in which they're going to put a catheter into your blood vessel and they're going to open it. I sometimes call this kind of like a roto-rooter. So before they would do an angioplasty, they would do an angiogram. So an angiogram, they would basically inject dye into your arteries to see if you have plaque built up. Plaque is basically similar to the plaque on your teeth. It's not the exact same plaque, but it's a buildup of fats, plaque, in your arteries. And if the buildup is so severe, the blood flow cannot go through. So what an angioplasty does is it goes through and kind of roto-rooters, kind of like the plumbing in your house, and cleans out those arteries. If that doesn't work, or in addition to, they may end up putting a stent. The stent is seen in the second picture. A stent can be almost kind of like a wire trap whose job is to keep that artery open, to keep the blood flowing through. Bypass. So the way I think of a bypass is rerouting blood. So if you're in a major city, they often have bypass routes or highways to circumvent the city. So if angioplasty doesn't work and a stent doesn't work, they will do a bypass. They're going to reroute the blood away from the blocked artery. It is essential that all of the blood can flow to all of your body parts. Otherwise, heart attack, strokes, etc. occur. So by rerouting this blood, it hopefully is ensuring that the blood is getting to all of your body parts. So if you know someone that's had like a triple bypass or quadruple bypass, the bigger the number, the more arteries and veins, specifically arteries, they are rerouting. So reroutes blood away from these blocked arteries to keep the blood flowing to all of your body parts. Heart attack. So we have this word thrombus. So in our blood chapter, we looked at the word prothrombin, etc. So thrombus is a blood clot, which we don't want, that blocks coronary blood vessels. And an infarct is an area that dies from lack of oxygen. So in other words, if an area of your heart, an artery specifically, does not get oxygen to it, then it dies, just like all the other cells in your body. Your body requires, every cell requires oxygen to make ATP and to live. So if this is a small portion of your heart, you typically can live a long, healthy life. However, if it's a large portion of your heart that has a lot of oxygen, they may have to do something like a heart transplant or put in different devices in your heart to allow it to beat and allow you to live. Study questions. The thin inner layer of your heart, what is that called? The inner layer. Endocardium, epicardium, myocardium, intercalated disc. Inner is endo, letter A. This is a major holding chamber. Right ventricle, right atrium, left ventricle, aorta. So which of these is a holding chamber? B, right atrium. This structure ensures one-way blood flow. Tricuspid valve, bicuspid valve, aortic semilunar valve, all of the above. The job of a valve is to ensure one-way blood flow. So all of these are valves which have the same function. So letter D. The SA node is located in the right ventricle, left ventricle, aorta, right atrium. The SA node was part of the conduction system of the heart. It's where the blood flow began, so letter D, right atrium. The ion responsible for the plateau phase is sodium, calcium, potassium, chlorine. B, calcium. So before we leave chapter 13, let's talk about a couple things. Then we have one more part of this presentation, a third video, and it is over blood vessels. You should be able to label blood vessels, arteries, and veins and know whether they supply blood to or carry blood away from. So before you watch part 3, it is recommended that you fill in page 170 through 173 in the PowerPoint packet. Do this before you watch the third part of this presentation.